Well, Dr. Bajwa has certainly been at the forefront in the development of our neurosurgical program here at UHS. He's someone that I've worked very actively with in developing a vision for that program. The CyberKnife program was an example of that. Dr. Bajwa saw the evolution of that technology and could understand very early on, before most of his peers, how that technology would be beneficial to the care of the patients we have here at UHS. Dr. Bajwa is someone that's full of energy, full of dedication, full of commitment, full of vision, and has very skilled hands when it comes to the care of his patients. And that skill not only extends from the technical component that he brings in terms of the accuracy and diligence within the surgical field, but he has a very big heart, and he's a caring physician and very well respected by his clinical peers and very well respected by his patients. Can't tell you how many letters I've received about Dr. Bajwa, but it's scores of letters related to the skilled technical aspects of the care, the recoveries that he's worked with people to make from illness or injury, but the heart and soul that he brings to his practice that emanates in the words of patients about the care that he has provided. Dr. Bajwa is important to our community, and he's important to UHS, and most importantly, he's critical to the care of patients within our community at UHS. His absence, frankly, would leave a void here and could be at the detriment of patient care.
One of the few institutions that have a stroke center, we're able to take care of patients who have an acute stroke without the care of many of our interventional radiologists, as well as the neurologists, and also with the backup of the neurosurgeons. Patients who need help with a stroke, which is similar to a heart attack, may end up leaving the hospital paralyzed, unable to speak, being committed to the rest of their lives in a nursing home. But because of many of the things that Dr. Bajwa has instituted, these patients come into the hospital and are able to walk out with their full faculties. I would like you to take all of this into consideration, because not only does Dr. Bajwa take care of his individual patient as a surgeon, but he really is responsible for the entire community being taken care of in a variety of medical conditions. He's tirelessly working and fighting on behalf of every patient in this community. He's highly respected and admired, both by his colleagues, by physicians, and by patients, who every day when I interview patients before surgery, if they've had surgery with Dr. Bajwa in the past, they almost always speak in glowing terms about how devoted he was to them and how tirelessly he worked either for them or he worked for a member of their family.
Dr. Bajwa is an active neurosurgeon, to say the least. He routinely does 800 to 850 cases a year, which is probably 3 times more than your average university neurosurgeon is willing to do in a year. The trauma center obviously is critically important for the care of our citizens here. We're in the southern tier of New York, responsible for approximately 750,000 lives. We see a lot of blunt trauma, a lot of motor vehicle blunt trauma, and that's a lot of head injury, a lot of spinal injury. Without his enthusiasm and expertise, a lot of these patients would be transferring out. His level of expertise is without question beyond peer. He's absolutely fantastic, but going beyond that, the level of compassion and caring that he shows for his patients is not typical. It's really, really awe-inspiring. It's something that you can see that this guy, there's something else driving him. It really is. It's a love of man, if you will, a real philanthropist, if you will. The level of neurosurgical services that that he brought here is bar none. Because he's been here, we now have a neurovascular interventional program. Probably one of the first in upstate, in New York for that matter. So it's just what people get here, they don't know. And you don't know until it's gone. I know that he has done a great deal of work in Pakistan in terms of education, particularly of women, and health care. And I got to see that side when there was a devastating flood in Kashmir where many thousands of people died, and he rallied troops to get funds there, and it's just amazing what he did. It certainly would be a tragedy if Dr. Bajwa was no longer able to practice in this community. As already stated here, his body of work over these past 25 years demonstrated an unparalleled, unquestionable commitment to the patients and excellence, and has really raised the bar or the boat for all of us here, and has inspired us and many of us.
My eldest brother, Dr. Muhammad Hussain Bajwa, set up a college in Rahim Yar Khan with the name of Tamir-e-Millat High School. It was a high school. He started in early 50s. Dr. Saeed Bajwa, who is a neurosurgeon and working in USA, he is also graduated from that school. My father once told us that if you want to give a gift to your poor relative, the best gift is educate his children. So I asked my brothers, my sisters, my nephews, my nieces and relatives and friends for their donations. I remember Dr. Saeed Bajwa was the first donor. We educate the poor people who just cannot afford, or who are lesser means. We were running Ikra Boys High School, Ikra Girls High School, Ikra Boys College, and Ikra Girls College. That we have been able now to reach a level where Ikra school and colleges and all this, the whole project, it is the largest educational project in the Bahawalpur state.
I am personally indebted to Dr. Saeed Bajwa and his family. I have known him since his childhood. In fact, I benefited by getting my initial education in high school, which was established by Dr. Bajwa's father. I feel that this Tamir-e-Millat school in Rahim Yar Khan gave me a head start in life, enabled me to go on to get professional education. This issue of establishing educational institutions seems to be very dear to heart of this Bajwa family. Bajwa family has run schools in Rahim Yar Khan district for more than 50 years. Their current institutions are both at the primary, intermediate and advanced level, where schools and colleges are very well respected because of their academic performance and delivery of not only modern education but social values which are critical to making up good human beings and citizens. Dr. Saeed Bajwa has always taken personal interest in establishment of these educational institutions. It takes not just money but also gathering the appropriate professionals to be able to establish good institutions. The Shifa family has benefited from Dr. Saeed Bajwa's ongoing participation in charitable care of indigent patients. This became a focus after the devastating earthquake of 2005, when hundreds of thousands of people not only were injured and became disabled, but thousands lost their lives in that earthquake. Dr. Saeed Bajwa and his colleagues, they were very prompt in not only collecting funds, collecting medicines, surgical supplies, but also groups of medical and paramedical personnel who came here, and they established camps in the earthquake area. And then for the advanced surgeries for people who had spinal injuries and were crippled and bedridden, their timely help was most useful.
There are providers in this community who are generous with their skills. I would absolutely put Dr. Bajwa at the top of that group. Because of working on those floors, I would also see his day-to-day practice with other patients and families. And what I saw in my own husband's care and what we received as care, I thought was extraordinary. He made sure you knew exactly what he was going to do, what the risks were, what the benefits were. That's standard for doctors, but to be able to communicate that with a wide variety of people is amazing, and Dr. Bajwa does do that. He does not give differential services based on private pay versus no insurance versus you're a VIP. Everybody is treated the same, and you come out feeling as if you're a VIP because in his eyes you are. Dr. Bajwa brings a certain skill set here that you normally would only see in a major metropolitan area. For folks like my husband, that is huge because he could have been legitimately sent somewhere else to get treatment, which would have been an extraordinary hardship for us. That Dr. Bajwa does what he does on a day-to-day basis is extraordinary. It's nothing short of miraculous. He gives people independence. He gives you hope. He makes such a change and impact in the people's quality of life. It's huge. I've seen that myself for my own family. I've seen that in the families and the patients that I work with at the hospital. Not just people in this community, but his generosity of spirit that he sponsors other people that come here, provides that same level of service regardless of who you are, regardless of your ability to pay. That's what makes him special, that he does that with no accolades, no fanfare, is huge. You don't see that. I can't overstate what he means here. And yes, we would still have surgery services here. It would not even be remotely the same because he leads by example.
I was assaulted my last year before graduating college. I was badly beaten into a coma, and Dr. Bajwa actually did the surgery to save me.
Dr. Bajwa was the kind of person that allowed us to feel comfortable, to trust, to take care and do what was necessary with our only child.
Worked very hard to make sure that my recovery was done properly, and my care was very intense, and he made sure that it was all done properly. And thankfully, look at me today. It's all thanks to Dr. Bajwa.
He came across as a very warm, genuine person. You felt, empathy from him. You felt he could probably feel for your situation, your children of his own.
I went back out to Binghamton as a thank you, basically say thank you to the people who saved me. And of course, Dr. Bajwa was the first person that I said thank you to. And he had a reception in the hospital to welcome me back to Binghamton, which is very, very wonderful. I loved it.
I'm just glad he was there.
I think the outcome could have been very different without a really top neurosurgeon on his case.
Dr. Bajwa definitely had a very large impact on my life. As being a good doctor, being a professional, and being just a good person, he took me under his wing and helped me recover. Really led my recovery, not just helped me, but led it. But medically, he's a genius. He's one of the best in the business. So to lose him, they're very sad to me.
It would be a great loss for Dr. Bajwa not to use his skills, not to be there, and especially the kind person he is, at least from our experience. I hope that he'll be able to continue his practice and do the good job he did for our son.
For Dr. Bajwa, I say he's the highest quality doctor for brain injury that I've ever seen, and I'd be such a shame if he didn't be able to practice his field and continuing pushing all the boundaries of brain injury recovery. So please let Dr. Bajwa continue to practice medically.
When I interacted with Dr. Bajwa, it wasn't just me interacting with Dr. Bajwa. It was my family interacting with Dr. Bajwa. He not only took me as a patient, he took my entire family. Not only does he have the talent given by God himself, but his bedside manner and the way he treats people and patients, he should just teach that alone, and this world will be a much better place. In my training as a medic, I had to do some OR time, and I asked Dr. Bajwa if I could observe one of his surgeries. He didn't hesitate one bit. Dr. Bajwa commanded a presence in the OR room. Everybody knew that they had to be on their best because he was giving his best, and that's what he wanted, and that's what he expected. The number of people that have come through this office to be taught, to learn, to be mentored, is staggering, and every one of them have walked out a much better person, not only because of their knowledge, but because of the way they were treated and the way he expects them to treat other people. The compassion, the family values that he has exhibited in my presence has been extraordinary. The severe injustice of taking him out of our community, not only this community here, but in the community of the medical profession within the East Coast, would be absolutely terrible.
First met Dr. Bajwa probably 4 months after my daughter was injured. He was the first medical person that we had met in all of those months who gave us hope. The impression that he leaves me is truly as caring, and the fact that he could be in surgeries all day long, in office all day long, and yet take the time to come and be sure that the families are doing well. He is truly respected everywhere. For many, many, many years, and before his mother passed away, he would spend a month in Pakistan every year and give of his services. We need him. We need him here. We need him to continue in his practice. We need him to continue to help everyone that he has helped and to help more in the future. I know Dr. Bajwa as a humanitarian. To take this man from our community would be a huge loss to all of us. A huge loss not only to our community, but to people from all over the United States that have come here for his service and care, people from third world countries that he has cared for.
Dr. Bajwa and I serve on the Board of Trustees of Islamic Organization. In that capacity, I've known him and I have worked with him for the past 25 years. And he's been such a pillar for this community. I have seen him steer this organization through some significant changes. When I look at what Dr. Bajwa does, not only for the hospital and its patients, but what he does for the community is unparalleled. And as you talk to different people that have interfaced with him, the one thing that keeps coming back repeatedly is his selfless devotion to the patient care and the healthcare facilities. He's equally excited about providing educational facilities to the poor and the needy, which is most of the work that he has done in Pakistan, where he has supported colleges and schools for young boys and young girls that come from very poor backgrounds, that have been orphaned as a result of some of the earthquakes that have taken place. And it's through funding that he has provided that they have found the opportunity of getting education so that they can make something of themselves. This is the character that I have seen of Dr. Bajwa through the years and through repeated interactions that I've had in working for different charities or going with him to visit facilities and visit patients that have been in the hospital through the time. What I'd like to say to the Honorable Judge is you've probably seen many cases brought in front of you. Dr. Bajwa's is very unique. I've known him for over 25 years, both as an associate and as a friend. He is a man of the highest integrity and ethics, and I plead with you to be as lenient as possible as you decide on the outcome of his particular trial. Thank you.